Mesothelioma is a cancer affecting the mesothelial cells. These are the cells that cover the surface of the majority of our internal organs. Mesothelioma cancer is found to develop in the pleura, or the tissue lining covering the lungs, and is therefore called pleural mesothelioma. The peritoneum, or the tissue lining the abdomen, thus the name peritoneal mesothelioma. Between these two types of mesothelioma, studies show that there are more cases of pleural mesothelioma than that of peritoneal mesothelioma. When patients are suspected to be suffering from mesothelioma, a diagnostic procedure called a mesothelioma biopsy is performed to confirm diagnosis. There are multiple ways to get a diagnosis. The sample of a cancerous mass is obtained. The fluid surrounding the mesothelioma lung is removed and then examined. Samples of tissue specimens are taken from the mesothelioma lung. Because fluid diagnosis can be ambiguous, it is sometimes insufficient to verify if the cell type is sarcomatous, epithelial, or mixed. Diagnostic surgery then becomes necessary to obtain a confirmatory diagnosis. Diagnostic surgery. Video-assisted thoracic surgery allows a physician to examine the patient's pleural space with the use of a camera. At the same time, the physician can extract the necessary amount of specimen samples to be analyzed by the pathologist. The procedure requires small incisions to be made, and its invasive nature is often a cause of concern for increase in tumor seeding. Thoracoscopy is less invasive, but is only done when the pleural space has not been destroyed by the tumor. A therapeutic procedure to relieve fluid accumulation can be done simultaneously with thoracoscopy. Another procedure, laparoscopy, is performed on patients after video images show that the tumor has possibly forayed through the diaphragm. The peritoneal biopsy procedure requires the surgeon to make a cut through the abdomen. A peritoneoscope is then inserted through the abdominal cavity. Images are then viewed by the surgeon through a video screen, and samples are extracted for the pathologist to examine. When the final diagnosis is positive mesothelioma, the patient will then undergo treatment. Potentially curative surgery. This type of procedure is done with the intent to get rid of all gross disease. However, since microscopic disease will likely stay behind, adjuvant therapy will also be performed. This is an additional treatment to the main therapy and is performed to remove any remaining disease. Pleurectomy decortication is usually performed on patients in the early stages of pleural mesothelioma. When the lung has to be removed to eliminate all traces of tumor, it can be done simultaneously through the pneumonectomy procedure. Extrapleural pneumonectomy is considered more radical, and statistics show that it wasn't successful in prolonging a life longer or achieving a cure. The surgical treatment is usually integrated with radiation therapy, chemotherapy, photodynamic, gene, or immunotherapy. Cytoreductive surgery is performed with the intent to eliminate most, if not all, gross tumor found in the peritoneal cavity of peritoneal mesothelioma patients. Intraperitoneal hyperthermic chemotherapy is then administered to the abdominal cavity to remove all traces of tumor. Palliative surgery does not target the disease itself, but is only intended for the treatment of a mesothelioma symptom. Pleural effusion or fluid buildup is the initial symptom that makes a patient seek medical attention, and this procedure is then administered. Pleurodesis, or chest tube drainage, is the most common palliative treatment. It involves fluid drainage and closing the pleural space to eliminate the problem. Pleural peritoneal shunt involves placing a catheter under the patient's skin, connecting the peritoneal cavity to the pleural cavity. When an extensive surgery is not possible for a patient to undergo, then a pleurectomy is the next option. However, gross or visible tumor will not be removed completely. It controls pleural effusion effectively when it is restricted lung expansion because of the cancer. Thank you for watching. This video was produced by Asbestos.Net. a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.Net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.Net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.Net. Information and help for patients and families.